This tutorial is about other primary headaches. Other means other in relation to migraine, tension type headache, and trigeminal autonomic cephalalgias. It's a very interesting group of relatively rare headache disorders, but they are very, very important, especially for headache specialists, because we see quite a good number of these patients in tertiary headache referral centers. Here you see the classification to the second digit, and there are actually 10 of these headaches. Primary cough headache, primary exercise headache, primary headache associated with sexual activity, primary thunderclap headache, cold stimulus headache, external pressure headache, primary stabbing headache, nummular headache, hypnic headache, and new daily persistent headache. We'll try to go through them, but I can't, of course, due to time limitations, go through every single aspect of these definitions. Primary cough headache is a headache that occurs only with coughing or straining or Valsalva maneuver, so it's expected that it's caused by venous dilatation. And it's a kind of headache where we always have to exclude a secondary cause, because it's also seen with brain tumors and so on. Primary exercise headache occurs only during vigorous exercise. Exercise, as you probably know, can induce a migraine attack. Many migraine patients are sensitive and actually cannot do a workout because it will trigger their migraine attack. That is not an exercise headache. A primary exercise headache is a kind of headache that occurs only during strenuous exercise. Primary headache associated with sexual activity is a headache brought on by and occurring only during sexual activity. It's in most cases increasing in intensity with increasing sexual excitement, or it occurs simply as an explosion at the time of orgasm. Previously there were some subforms distinguished, but excellent field testing by Professor Jujian Wang in Taiwan have shown that it's better to lump the criteria together as it is done here. It's of course terrible for the individuals because it ruins their sex life, but they are very good. Opportunity treatment possibilities, and it's very, very rare that it is a continuous problem for the patients. Primary thunderclap headache is a common thing seen in emergency rooms. People come in with a sudden onset of a severe headache, and obviously we immediately think about ruptured aneurysm and subarachnoid hemorrhage. However, there are some studies showing that it's actually the minority of patients who present in emergency rooms with thunderclap headache who have a subarachnoid hemorrhage. Thunderclap headache is also seen in other diseases. Ischemic stroke can be associated with a thunderclap headache. Reversible cerebrovascular constriction syndrome is actually very, very typical, that it has often repeated thunderclap headaches. So it's always to be taken very serious, and very extensive investigational programs have to be done before we can conclude that it's a primary thunderclap headache. External application of cold being outdoor on a frosty day without a hat. It can be unpleasant. But some patients get actually quite a severe headache in that situation. And it's of course, it's never caused by a secondary cause. And we can just diagnose it and comfort the patient that there's nothing serious going on. Please remember your hat. And it's about the same with ingestion of cold. It's called ice cream headache. If people eat an ice cream too fast, the cooling of the pharynx apparently in some patients causes reflexly a headache that can be quite severe, but is transient. And again, it's never caused by something serious. And we can just explain this to the patient, and the patient will be happy. A similar thing can be said about external compression headache. People who are wearing a band around the head or a tight strap from, for example, goggles. And in some patients, it's not only an unpleasant sensation where you have the strap, but it causes, reflexly causes a headache. Also a very benign thing that just requires some explanation. And this is true also external traction headache, also called a ponytail headache, and especially females when they tighten the hair too much. And this traction can induce a headache. Primary stabbing headache is very, very interesting also. Again, it's virtually never caused by a brain tumor or anything else secondary, but it scares people a lot. It's short-lasting stabbing, jabbing, pain, usually in an isolated area, most often in the parietal area, but it can occur in several different places on the cranium. It's more common in patients who have migraine, but of course very distinct from the migraine attacks. And it usually only requires some explanation, but in cases where it's repeated and very bothersome, it can be treated by indomethacin or other drugs. Nomular headache is headache in an isolated, circumscribed area of the head. It's well described. The area size is 1 to 6 centimeter. It's round or elliptical. It's the same size every time, and it's sharply contoured. And nobody understands why it comes. It can be observed after a minor localized head trauma, but in that case it's coded as a post-traumatic headache. So nomular headache is only when there is no trauma, no known reason. Difficult to treat, and there are no real good studies of how to treat it. And of course this is true for all these entities in this chapter. They are pretty rare, and it's been impossible to do double-blind controlled trials. And there's still a lot of observational studies needed to better describe all these entities. This is also true for hypnic headache. Previously, it was defined as a headache occurring in middle-aged to elderly people, and it is typical in this age group, but there are also many cases younger, and therefore it's not part of the age criterion, is not any longer part of the diagnostic criteria. So it occurs only during sleep, it awakens the patient, It is self-limiting, usually only of moderate severity, and not associated with the restlessness and agitation that's typical of cluster headache, which is the only other headache that typically occurs during sleep and awakens the patient. So it's not difficult to distinguish hypnic headache from cluster headache. The last entity in this group of other primary headaches is new daily persistent headache. And it's a headache that comes on a particular day for no good reason, and it never leaves the patient. So the patient has a continuous headache after that. Sometimes it can also on certain days have migraine-like characteristics, but mostly it's a constant moderate headache, more similar to chronic tension type headache, but it's the distinct abrupt onset that is the hallmark of this disease. It's not infrequent in headache centers and unfortunately very difficult to treat, and no double-blind trials are available, and they are really a treatment problem in headache centers. A lot needs to be done in order to understand what the possible mechanisms can be. Nobody believes anymore in psychological mechanisms because this has already been explored. But what is it then? We don't really know. So that was a tour de force through the other primary headaches. Thank you very much.